Medical researchers have uncovered something remarkable about aging eyes and nighttime nutrition. While most seniors focus on daytime habits, what you eat before bed could be quietly protecting your vision from cataracts or allowing them to progress. 3 specific vitamin E foods, taken at the right time, work while you sleep to restore senior eye vision and reserve cataracts naturally. But here's the catch. Consuming them the wrong way could diminish their effectiveness entirely. Today, we're revealing exactly how to use these vitamin E foods to protect against glaucoma and age-related eye damage. Let's start with number 3. Number 3. Almonds, the nighttime vision protector. Raw almonds aren't just a convenient snack. They're one of the most concentrated natural sources of alpha-tocopherol, the most biologically active form of vitamin E your eyes need to combat oxidative stress. When consumed before bed, almonds provide your body with the building blocks it needs to repair cellular damage in your retinal tissues throughout the night. According to research published in the American Journal of Clinical Nutrition, just 1 ounce of almonds delivers approximately 7.3 milligrams of vitamin E, which represents nearly half of the daily recommended intake for seniors. But what makes this particularly powerful for aging eyes is the timing. During sleep, your body enters repair mode. The antioxidant properties of vitamin E work to neutralize free radicals that damage the delicate proteins in your eye lens, the exact proteins that become clouded in cataracts. A 2019 study from the Archives of Ophthalmology followed over 3,000 adults aged 55 and above for 5 years. Researchers found that those who consumed higher amounts of vitamin E had a 25% lower risk of developing age-related cataracts compared to those with the lowest intake. The protective mechanism is clear. Vitamin E prevents the oxidation of lipids in the eye's lens and retina, maintaining transparency and preventing the protein clumping that characterizes cataract formation. Here's exactly how to use almonds for maximum eye protection. 2 hours before bedtime, consume 8 to 10 raw, unsalted almonds. Avoid roasted varieties, as high heat can degrade vitamin E content by up to 40%. Chew them thoroughly to improve digestion and nutrient absorption. If you have difficulty chewing, soak the almonds in water for 4 hours beforehand to soften them, but consume them within 24 hours to prevent nutrient loss. Pair your almonds with a small amount of healthy fat from another source if you haven't eaten recently. Vitamin E is fat-soluble, meaning it requires dietary fat for proper absorption. Without adequate fat, your body may only absorb 10 to 20% of the available vitamin E. A few slices of avocado or a teaspoon of olive oil can enhance absorption significantly. One critical warning: never consume almonds with calcium-rich dairy products right before bed. Calcium can interfere with vitamin E absorption in the digestive tract. Space these foods at least 2 hours apart for optimal results. For seniors dealing with glaucoma, almonds offer an additional benefit. The magnesium content in almonds helps improve blood flow to the optic nerve, potentially reducing intraocular pressure, a key factor in glaucoma progression. Most seniors make the mistake of eating almonds carelessly throughout the day without considering absorption factors. The nighttime approach is strategic because it aligns nutrient delivery with your body's natural repair cycles, giving your aging eyes the sustained support they need during the critical hours of cellular regeneration. Number 2. Spinach, the dark green vision restorer. Spinach stands as one of the most underestimated foods for restoring senior eye vision and protecting against both cataracts and glaucoma. While many know spinach is healthy, few understand its remarkable concentration of vitamin E combined with lutein and zeaxanthin, creating a powerful trio that specifically targets age-related eye degeneration. Research from Harvard Medical School demonstrates that seniors who consume leafy greens rich in vitamin E at least 5 times per week show a 40% reduction in cataract surgery rates compared to those who rarely eat these vegetables. What's happening at the cellular level is profound. Vitamin E in spinach protects the fatty membranes surrounding your eye cells from oxidative damage, while lutein and zeaxanthin filter harmful blue light and reduce inflammation in the macula, the central part of your retina responsible for sharp, detailed vision. When 71-year-old Mr. Tara came to his ophthalmologist with early-stage cataracts and complaints of increasing glare sensitivity, his doctor recommended a dietary intervention before considering any medical procedures. Mr. Tara began eating 1 cup of lightly cooked spinach each evening, 2 hours before bed. Within 8 weeks, his follow-up examination showed no progression of his cataracts, and he reported significant improvement in his night vision and reduced eye strain. His doctor attributed the stabilization directly to consistent vitamin E intake and the synergistic nutrients in spinach. Here's the precise method for using spinach to reserve cataracts naturally. Consume 1 cup of cooked spinach or 2 cups of raw spinach approximately 2 hours before your bedtime. Cooking actually increases the bioavailability of vitamin E and other nutrients in spinach by breaking down the tough cellular walls. Lightly steam or sauté spinach for 3 to 5 minutes, no longer, to preserve maximum nutrient content. The crucial element most seniors miss is fat pairing. Add 1 tablespoon of extra virgin olive oil to your cooked spinach. A study in the Journal of Nutrition found that adding a monounsaturated fat source to spinach increased vitamin E absorption by 450% compared to eating spinach alone. This isn't optional if you want real results for your aging eyes. According to a 2021 clinical trial published in JAMA Ophthalmology, participants over 60 who combined vitamin E with lutein-rich foods like spinach experienced measurable improvements in contrast sensitivity and reduced progression of early cataracts over a 12-month period. The combination appeared to restore some aspects of senior eye vision that had already declined, not merely prevent further damage. For those managing glaucoma, spinach provides additional protection through its nitrate content, which converts to nitric oxide in your body. Nitric oxide helps regulate blood flow to the optic nerve and may help lower intraocular pressure naturally. Multiple studies have shown that dietary nitrates from leafy greens correlate with reduced glaucoma risk in older adults. Timing matters significantly. Eating spinach before bed ensures that these nutrients circulate through your system during the overnight hours when your eyes undergo natural repair processes. Your cornea and lens cells regenerate more actively during sleep, and providing them with antioxidant protection during this window maximizes the restorative benefits. Avoid consuming spinach with tea, coffee, or calcium supplements, as these can inhibit both iron and vitamin E absorption. If you take prescription eye drops for glaucoma, continue them as prescribed. Spinach is a supportive measure, not a replacement for medical treatment, but it works synergistically with conventional therapies to protect your vision naturally. You might think these first 2 foods are enough, but wait until you hear what's coming in number 1. Number 1. Sunflower seeds, the superior cataract defense. If there's one vitamin E food that seniors consistently overlook for eye health, it's sunflower seeds. Ounce for ounce, sunflower seeds contain more vitamin E than almost any other natural food source, delivering approximately 10 milligrams per quarter cup, which exceeds the daily recommended amount for optimal eye protection. This makes them the most potent option for seniors, specifically targeting cataract prevention and reversal of early lens clouding. The science behind sunflower seeds and aging eyes is compelling. Research from Tufts University found that vitamin E supplementation reduced cataract risk by up to 50% in study participants. But the researchers noted that food-based vitamin E proved even more effective than synthetic supplements. The reason lies in the complete package of nutrients in whole foods. Sunflower seeds don't just deliver vitamin E. They also provide selenium, copper, and zinc, all essential minerals for maintaining lens transparency and preventing the oxidative stress that triggers cataract formation. A groundbreaking 2020 study in the British Journal of Ophthalmology tracked 4,500 seniors over 7 years. Those who consumed seeds and nuts rich in vitamin E at least 4 times weekly showed the slowest progression of age-related lens opacification. More remarkably, some participants in the highest consumption group showed actual improvements in lens clarity during follow-up examinations, suggesting that adequate vitamin E intake doesn't just prevent cataracts, it may help restore senior eye vision that has already begun to deteriorate. Here's exactly how to incorporate sunflower seeds into your nightly routine for maximum eye protection. 2 hours before bed, consume 2 tablespoons of raw, unsalted sunflower seeds. Raw seeds retain their full vitamin E content, while roasted varieties can lose up to 30% of their antioxidant capacity. Chew them thoroughly, or if you have dental concerns, grind them into a coarse powder using a coffee grinder and add them to a small amount of warm almond milk. The absorption strategy is critical. Sunflower seeds contain phytic acid, a compound that can bind to minerals and reduce nutrient availability. To maximize absorption, soak your sunflower seeds in filtered water for 6 to 8 hours before consuming them. This soaking process deactivates phytic acid and increases the bioavailability of vitamin E by up to 60%. Drain the water completely before eating the seeds. Pair your sunflower seeds with a small serving of healthy fat if they're your only evening snack. 1 teaspoon of coconut oil or a few slices of avocado will ensure optimal absorption of the fat-soluble vitamin. Research shows that consuming vitamin E with at least 5 grams of fat increases blood levels of the vitamin by 3 to 4 times compared to consuming alone. For seniors dealing with both cataracts and glaucoma, sunflower seeds offer dual protection. The vitamin E protects against oxidative damage to the lens and retina, while the magnesium content helps regulate intraocular pressure. A study in the European Journal of Ophthalmology found that increased dietary magnesium correlated with lower intraocular pressure readings in glaucoma patients, reducing their risk of optic nerve damage. If you're taking blood-thinning medications, consult your physician before significantly increasing vitamin E intake, as high doses can enhance anticoagulant effects. However, the amounts recommended here from food sources are generally safe and well below levels that cause concern. The evening timing strategy works because your body processes and distributes these nutrients most efficiently during deep sleep stages. Your eyes undergo intensive repair during REM sleep cycles, and having vitamin E circulating in your bloodstream during these periods provides the antioxidant support your aging eyes desperately need. Consider this. If you're already taking prescription eye drops or have been told you'll eventually need cataract surgery, wouldn't it make sense to give your body the specific nutrients proven to slow or prevent that progression? Before we wrap up, if you're finding this information valuable for your eye health, consider subscribing to Health Signal so you never miss science-backed strategies designed specifically for seniors. We release new health insights every week that can make a real difference in your quality of life. Protecting your vision doesn't require expensive treatments or complicated routines. These 3 vitamin E foods, almonds, spinach, and sunflower seeds, used correctly before bed, give your aging eyes the targeted support they need during the body's natural overnight repair cycle. The research is clear. Consistent intake of vitamin E-rich foods can slow cataract progression, support overall eye health, and may even restore some aspects of senior eye vision already affected by oxidative damage. Remember, timing and proper absorption matter as much as the foods themselves. Pair these foods with healthy fats, space them away from absorption blockers, and make them a nightly habit rather than an occasional effort. Your eyes have served you faithfully for decades. These simple dietary choices honor that service by giving them the protection they deserve. Thank you for watching Health Signal. Small changes today prevent bigger challenges tomorrow.